that a patient could access.
In Lyric, though, still, it's telemedicine, but it's bought out, maybe I'm wrong.
Yeah, actually, I don't know the exact terms of the deal. I think it was more of a rebranding than anything else. But we personally have the same benefit at Brinson, and I have tested it myself and have found the service to be comparable, if not even enhanced. Yeah. So your particular option includes behavioral health support. A person can call, and then once the evaluation is done, they will have really an unlimited number of telephonic counseling sessions. I will say, due to a lot of laws, if a patient were assessed in needing something more enhanced that includes medication prescriptions, then they would be referred back to your medical plan because it's illegal to actually assess or prescribe at this current point in time over the telephone.
So does that include alcohol dependence, drug abuse, anything like that?
It can include counseling of all kinds, so addiction would be one of those, grief another one, yes, so it does include that.
And, I mean, these are genuine questions, I'm just trying to understand.
Yeah.
So do our employees know that if we spent $19,400 on alcohol dependence, was that for them to seek more care in a clinic, or is that what I don't understand that.
Yeah, well, I would call Lyric the light version of that. Once a patient is assessed on a more in-depth level, then they would need to either go outpatient, inpatient, or perhaps see a more robust level of specialized care than what the telephonic support would be.
Does the health provide some of that?
It absolutely does. So under your health plan, it's actually treated as any other health condition for both mental health and substance abuse recovery. And that's actually mandated by federal law. So one of those things you couldn't take out even if you wanted to. Okay?
And, okay, I get it. When you were saying COVID test, that was additional tests. Like once you're diagnosed with COVID, then the doctors are abusing the amounts of tests that they...
We've seen evidence of that in some urgent care clinics, and some of that has to do with the ownership chain. We are seeing urgent care clinics that have purchased by hospitals, and so in some instances we've seen a surge in the number of referrals to a hospital emergency room even after the patient has tried to go to the least costly avenue for care and assessment. We've also seen an inordinate number of expensive scans ordered for just routinely for COVID patients, which even when they're minor is quite unnecessary. Now, if it's something major, we would expect that to be warranted. But those are some of the abuses.
We're seeing a lot of that where I work at Envision, and we're getting a lot of that where it's like, even the patient's like, I'm not even sure why I'm getting this.
Right.
That they come to us because it's cheaper than going to the hospital. And so, and that a lot of these patients are paying out of pocket. They don't even want to use our insurance because we give them huge discounts. I mean, these things are like $3,000, and out of pocket's $500.
Right.
So I'd rather pay $500 and just get it over with.
Right.
You know, because we've seen a spike in that. You know, it doesn't make any sense.
Yeah. But when you hear about COVID funding and all of this money being poured in, is that what goes to pay our bills, these claims here, or no?
No. It goes for a lot of things like the masks and different things like that, like what do you call them?
First responders usually are going to be the first in line to receive your financial benefits for that. And this is actually in a pooled plan. And sadly, my opinion is there is not enough provision for this, both in terms of the abuse and excessive spending, like nobody seems to be watching this. All these tests that are ordered are also hitting all the plans. We've seen tests on even just one individual in one of our plans over $40,000 in a matter of months. So we were able, in that case, to get them reimbursed, but these are the things. And it goes without saying, we are seeing a spike. It turns out maybe isolation isn't the most mentally healthy thing for all of us. And so we're simultaneously dealing with a spike in mental health, not only in our adult population, but most especially in our child population. So those are just additional expenses we see hitting every single plan that we manage.
Well, none of the COVID money that the federal government's putting out is gonna go toward
COVID. Not towards this.
Yeah, COVID.
Isn't it like paying for prevention?
Well, like our fire department gets all those test kits, we get all that,
Right.
different things like that. We get a lot from that kind of stuff, but not on that plan.
It's hopeful it just doesn't dip into this. And in addition, at the beginning of the pandemic, the governor ordered that frontline first responders also would be treated by default under workers' comp for things related to the pandemic. So to the extent those become major significant claims, then those actually are not even posting here in all instances. They're going to be reflected in increases in workers' comp down the road. And I'm hearing from my cities that you're already beginning to see those workers' comp rates go up.
Yeah, they have.
Any other questions this evening?
In the open enrollment, are we still inviting Aflac and Nationwide to come in and sign up for those employees that want it?
We are, Aflac, Nationwide, I've got to find a rep. My rep's gone, I have no idea who's our rep anymore, nobody's contacted me. But this year, last year we didn't have a normal open enrollment because of the COVID.
Okay.
So, but this year we are going to have where people can come in and all that stuff and sign up.
Yeah.
And like the lawyer thing,
Yeah, legal.
they come every year.
Yeah, Legal Shield, Aflac,
Yeah.
and there's no sense in having dental guardian if we're not changing. Melinda will be here
Yeah.
to answer any questions and things.
Your account executive with Brinson will go over all the benefits, and then we would have Nationwide and Aflac present if there's someone
Yep.
available.
Yep.
And we are seeing a shortage of those reps. I don't know where they went. But I'm the great vanishing of our supplemental carrier reps. I'm not sure what's going on.
Yeah.
So, we've seen. Any other questions?
I'd like to talk to the representative. You can go online and talk to
Are you
call them, but
Nationwide?
I'd like to sit down and, like they used to come out here all the time, or
Yeah.
even not just the enrollment time periodically to check in, but I guess they don't do that much anymore. The girls out of Mansfield,
Oh, the Nationwide lady?
yeah,
Yeah.
Brumley,
Oh, no, that's Aflac lady.
yeah, that, but.
Yeah, no, we don't, no, it's somebody else now.
I don't know.
I forget who,
We
but,
used to have the same guy come out for
yeah.
Nationwide all the time, and then
Yeah.
he retired and someone else, but I don't know who it is,
Marvin, is there anything, you said there's stuff she's still checking on. Is there a reason that
That's what we were checking on, was to get it to 5%.
Yeah, but I thought she said there was something else.
No, the rate
We
was
can
the big
approve,
thing.
we can approve this.
We can approve it now. It was 8% Friday,
Yeah.
so we were hoping that Dawn would work her magic, and she did.
Yeah, it went to 8, then we had a conversation at 6, and then finally successful to get to 5, which I do think is more fair.
Considering we've had 21 and 22% before, so.
You have. And we've had a few miracle years where somebody made a mistake in underwriting. We ran in here and got your approval really quickly.
Of the claims that we have, and I know with HIPAA we can't get into, but is there anything that's overlapping